Hi, I'm Jeannie Foley. I'm a registered nurse at the St. Elizabeth Florence Warmold Heart and Vascular Institute. Today we're here with Dr. Sinno. He is a cardiac electrophysiologist, and he's going to talk a little bit with us about atrial fibrillation, also known as AFib. Welcome. Thank you for taking the time to join us today.
Thanks for having me.
So I just kind of introed with AFib, or atrial fibrillation. Can you tell me a little bit about that?
Atrial fibrillation is the most common heart rhythm disturbance that we deal with in individuals older than 40. It is a disease process that is more specific to the left upper chamber of the heart in most individuals. It is the most prevalent condition in individuals older than 40, as we said. It impacts close to about 6 million people in the United States now, and by 2050, the expectation that it will hit around 16 million.
So if you think you're having AFib, what would be some common symptoms that you would experience?
Some individuals are heavily symptomatic with their atrial fibrillation, where they end up in the emergency department with every bout of atrial fibrillation. One of the most common symptoms for atrial fibrillation is palpitations or a rapid heartbeat. Some individuals experience lightheadedness, shortness of breath, chest tightness, fatigue, somnolence, and in some individuals, atrial fibrillation is completely silent. And unfortunately for this subgroup of patients, if they do not see their physicians regularly, the first presentation of their atrial fibrillation could be a stroke.
You said that somebody can have AFib and not realize it. So they're just walking around with no symptoms whatsoever, and they just happen to find it when they go to their doctor?
It's very correct. There are some individuals, as a matter of fact, they show up to their primary care physicians for their annual visit. The doctor listens to their chest, they find an irregular heartbeat, they get an EKG, and they confirm the diagnosis of atrial fibrillation. And there are other individuals that show up for surgery in the pre-op area for a screening colonoscopy, for example. They hook them up to the monitor and they can diagnose atrial fibrillation.
So it's important to talk to your doctor about that, even if you have no symptoms. I also heard you say that it increases your risk for stroke. Can you explain a little bit how AFib increases your risk for stroke?
Atrial fibrillation increases the risk of someone having a stroke by about 4 to 6-fold. And the reason this happens is because the top chambers of the heart, when they go into atrial fibrillation, they do not really squeeze. They go at a very rapid heartbeat, around 360 to 400 beats per minute. So if you think about it, those top chambers of the heart are not really squeezing and emptying. They are quivering. And when they quiver, the blood starts percolating in that left upper chamber of the heart. It's not emptying fully. And the blood is a thick product. It's not like water, where if it's stagnant, it's gonna clot. And those clots are the ones that can migrate from the heart and end up in the brain and cause a stroke.
As we get older, we can't prevent aging. And that to me sounds like something that I can't change, is also known as a non-modifiable risk factor. Are there other non-modifiable risk factors, things that I can't change that would make me more apt to have AFib? And are there things that I can change?
Sure. So yes, there are non-modifiable risk factors like you just mentioned. The biggest one of them is age. And as you said, yes, we do need the population to age, right? And the other non-modifiable risk factor is race. Caucasians are at an increased risk of having atrial fibrillation compared to African Americans and Asians. There are other modifiable risk factors that you have control over, including obesity, which is very prevalent, sleep apnea. There is a 1-to-1 correlation between sleep apnea and having atrial fibrillation, alcohol intake, and caffeine intake.
I've seen some commercials on television, and they're advertising these devices where you can detect atrial fib. Do they work?
Yes, so they are good screening tools. They are not good diagnostic tools because there are false positives. Sometimes this watch or the monitor that you can purchase on your own can tell you that, okay, this rhythm is inconclusive, or give you a diagnosis of atrial fibrillation while you're really just having an extra beat. They can diagnose or screen for atrial fibrillation in patients, and if it gives you an inconclusive result or even a diagnosis of atrial fibrillation, I think you should share that information with your doctor and have them look at those rhythm strips and confirm whether we're having atrial fibrillation or not.
So a lot of people say it feels like their heart's racing or they're having palpitations. Does that mean that they have AFib?
Well, palpitations is a very common symptom in patients who have atrial fibrillation, undoubtedly. But there are other conditions that can also cause palpitations. For example, extra beats that come from the bottom chambers of the heart that we call PVCs, or extra beats that come from the top chambers of the heart that we call PACs can cause palpitations in some individuals. Atrial flutters can cause palpitations, atrial tachycardias, sinus tachycardias in some individuals, and supraventricular tachycardias can all cause palpitations.
So I've heard a lot of people when they take blood pressure medicine say they no longer have high blood pressure because they think that it's cured. Is that true when people take medication for AFib? Are they cured or is it still present?
Well, it is like high blood pressure, like you mentioned, right? It's more considered a disease rather than a condition that you can just overcome and move along. For example, hypertension you just mentioned, this patient is hypertensive, he's on the medication. So if he stops the medicine, that blood pressure is gonna creep back up and cause problems. With atrial fibrillation, it's kind of similar where, yes, it warrants treatment, but before we discontinue the treatment, you have to have a clearance by your physician that the atrial fibrillation is no longer creating a problem. For some individuals, yes, we perform invasive procedures or minimally invasive procedures for them. We put them on medicines and we can control their symptoms, but at the same time, despite every effort that we make, the atrial fibrillation can come back. One of the most common, I should say, variables in regards to whether the atrial fibrillation is going to come back or not is whether negative remodeling has happened in the top chambers of the heart or not from the atrial fibrillation. If you catch atrial fibrillation early and the treatment is initiated early, there's not much negative remodeling. And yes, with minimally invasive procedures, you can really cure atrial fibrillation or be very successful with the management of atrial fibrillation. But once atrial fibrillation has been ongoing for a while, there is negative remodeling, there's scarring in the top chambers of the heart, curing atrial fibrillation becomes really hard.
So obviously I'm not getting any younger sitting here talking to you. When should I start talking to my doctor about AFib?
So if you start having symptoms that are worrisome to you, whether that's increased fatigue, you're having to take more naps during the day, you're experiencing palpitations, an irregular heartbeat, shortness of breath with exertion, then I think it's something that would warrant investigation and talking to your doctor about screening tools to find out whether you have atrial fibrillation or not.
Thank you, Dr. Sinno. Visit our website to learn more about the Take Time for Your Heart program.